Now, let's talk about using the AED on an infant. Yes, you can use an AED on infant, adults, and children, okay? AEDs are fairly simple to use and they're designed for people that have never used them in their life. There's generally a power button and a shock. With this AED, there's different pad sizes usually. There's pink, which are for pediatrics, or white, which are for adults. The pediatrics are usually from 8 years of age or younger, or 55 pounds or less. However, in this case, this is a dual use, so you can put them on adults and children like you said. So you want to fire up the AED and then just follow its directions once it gets started.
Remove clothing from the patient's chest.
Go ahead and remove the clothing.
Open packet
I'm gonna grab
and
my
apply
AED
pads onto
and make
patient's
sure
bare
I
skin.
put the correct location. Pad, log roll the
Press
patient over
pads firmly on
and place
skin.
it over the patient's back.
Apply pads
And then
as
I would
shown
just
in
follow
the
directions
pictures.
from the AED. Remember, it needs skin
Apply
contact in order to
pads
analyze
as
the
shown in the
heart rhythm.
pictures.
Can't put it
As
over the
shown in the
clothing
pictures.
in order to analyze what type of heart rhythm the victim's in
Apply
and determine
pads
if it
as
needs to
shown
shock the
in the
patient
pictures.
or not.